relaxing that shoulder, giving a little bit of a push here, okay? Dropping the shoulder. There you go. There it is. All right, come on up. And you know, in terms of the force, you'll notice I'm not jumping on the pelvis. I'm just pinning that pelvis.
Yeah.
The force comes from the hand, but that's the biggest thing. Is I want to make sure we're protecting that baby, but it's really just trying to pin onto that pelvis. So we have the back pain, and you said it's more so on that joint right there.
Yeah.
Okay. And so when did it start? Because you said it was like 3 weeks ago.
Yeah, about
Okay.
3 weeks ago.
What were you doing 3 weeks ago?
You know, I was doing a lot of cleaning, a lot of bending, lifting.
Okay.
Lifting a little bit, but bending a lot.
Did the pain start at that moment, or was it kind of like the next day?
It was definitely gradual.
Okay.
So it was the next day, maybe that evening, I started feeling
Okay.
bad.
So then, so it was like the same day, but it was like kind of a couple hours later. Okay. And then the pain, when it started, was it kind of more of like that sharp onset, or was it kind of like it wasn't so bad and then it progressively got worse?
It kind of wasn't so bad.
Okay. All right. But this, you said it started with the Taekwondo incident.
Yes.
Okay. Okay. Were you kicking in the air?
I did. I kicked in the air and
Okay.
I fell.
Okay.
Yeah.
But that was a long time ago.
Yeah.
Okay. And you're how many weeks again?
25.
25 weeks. Okay. Well, let's figure this. And you said your back pain usually happens every pregnancy.
Yes.
Okay. This is now your
My third.
Okay.
Yeah.
Congratulations again. All right. So, like I said, I know we've had your X-rays before you got pregnant, so it's really nice to be able to see that. But with pregnancy, it does kind of change some things. Now we do still have some stress from your previous X-rays, that we have some inflammation, or not inflammation, but how your pelvis kind of drops a little bit on that left side. So this is something that we're going to try to work on, because I know this is where you're feeling a lot of that pain. But you know, although things can change with pregnancy, I'm going to take a look and see, but I'm pretty sure this is still going to be pretty close to accurate of how things are, especially if it's been a chronic issue. Oh yeah, just got some pressure on the neck. How's the headaches doing?
They've been better. I have been getting them more frequently.
Have
though.
you?
Yeah.
Okay. So yeah. Yeah, for sure on the base of the neck, we're gonna work on that as well. Right there.
Yeah, I feel that.
You feel that? Yeah. Yeah, I can definitely tell you have quite a bit of inflammation there. How old's your youngest?
He's 2.
2.
Yeah.
Are you still picking up and carrying him?
I do.
Okay.
Yeah.
Yeah. Yeah, right there.
Yeah.
So we definitely have some pressure on the spine on multiple areas. The neck up here, the mid-back down here, and then for sure this is where we're seeing a lot of pressure here. So just kind of taking a look. So you definitely still have a higher shoulder from the last X-ray that we've seen. So we are going to try to relieve some of that pressure, especially when you have that pressure up here. That can cause this muscle to get real tense. Also down below, but I think this is where we're seeing a lot today. How often are you getting headaches right now?
Every day I have a headache,
Really?
but it's kind of like a pressure headache. It's not too painful. It's kind of like a dull headache.
Yeah. Okay, so what I'm feeling for right now is that swelling. So right there, you can almost feel like it just dips right into there. So right there, what number is that? 1, 2, 3, 4, 5, 6, and then 7. So here is T7, 6, 7. Any soreness on 7?
7, yeah.
Yeah, right there. You're gonna bring the knees out and then in. So feet together.
Okay.
There you go. And then butterfly wings like this, and then close. There you go. As far as you can, and then close. Scoot forward just a little bit more. There you go. So we're gonna take a look at which joint we gotta work on. So actually, even just like pushing on this, the left side sticks out more than your right side.
Oh, wow.
Yeah. So this is definitely. It seems like it's dropped and it's shifting back. So when that joint shifts down, that part here, the SI joint here,
Mm-hmm.
it sticks out and protrudes usually a little bit more than this side. So let's go ahead and move the joint here. So bring out the knees, and then in, out, and then in, out, and then in. So even when you do that, it kind of causes your pelvis to rotate like that. So it kind of pushes this way. So this joint's definitely moving a little bit better. Just the right side for me. Oh yeah, okay. Keep going. Yeah, so when you move that joint on the outside, this joint kind of moves with it.
Oh, okay.
So usually they should be isolated from each
Oh.
other. Just do the left side for me. There you go. Okay, so we got some work on that left hip for you for sure. 1, 2.
2.
2, a little bit more. C1 on the left. C2. 1, 2.
2.
2 is definitely okay. I'm gonna tilt you over to the side. Oh yeah, right there.
Yeah.
Okay, so it doesn't move as well to that right side. And then chin up a little bit. A little bit more. There
Wow.
it is. Yeah. Bring up the arm. Good. You did really good on that. So
Good.
let's scoot forward just a little bit. All right, so there's a couple things when it comes to pregnancy, right? The first thing is I don't want to jump on the baby, right? So we're just gonna pin and hold down onto the leg.
Okay.
The second thing is I don't want to twist or crank on you. So I'm
Yeah.
just gonna stretch you out a little bit, but I don't
Okay.
want to twist a bunch of the spine.
Yeah.
So we're just gonna focus right onto that joint, see if I can get that pressure off of that, and then we'll go from there, okay?
Okay.
So with that, we're just gonna get onto that joint. We're gonna push that down and lift that back up. I'm gonna go ahead and push this here. I'm gonna roll you quite a bit here, okay?
Okay.
So again, I don't want to twist this. I'm gonna bring the whole body with you. And I'm just gonna pin that pelvis down, okay? So with that, relaxing that shoulder, giving a little bit of a push here, okay?
Okay.
Dropping the shoulder. There you go. Good. Move real tight. A little bit more here. There you go. One more. There it is. Whew. All right. Come on up. And you know, in terms of the force, you'll notice I'm not jumping on the pelvis. I'm just pinning that pelvis.
Yeah.
The force comes from the hand, but that's the biggest thing is I want to make sure we're protecting that baby. But it's really just trying to pin onto that pelvis. So let's have you walk back and forth from you. And then we're going to take a look how you're doing. So go ahead and go back and forth. In terms of the pelvis, sometimes it's kind of hard to tell right away, but any difference in what we're feeling here? What does it feel like?
I feel like it's a little looser. It's still painful though.
Okay.
I still feel like a sharp pain when I walk.
Okay, so let's figure out how that's looking. First, we're going to do this first. A little bit. Perfect. So, belly here, chest here, and then face down. Perfect. So we kind of have a double sense of protection for the baby here. So the spring's going to give out a little bit, so that way there's no pressure on there.
Okay.
And it's going to go nice and slow, okay? There you go. Good. All right, relax in there, breathing in, deep breath. All the way out, dropping the shoulders, relax. Nice. Ooh, that was a good one.
Felt good.
Yeah, that was awesome. Keep going. Good. And so you feel like there's a little bit of less pressure on there? But
Less pressure.
Okay.
I still feel the sharp.
that sharp pain
Yeah.
there? Okay, one more time. Go ahead and walk one more time. And then there. Can you point to where you're feeling that sharp pain?
It's right around here.
Right in there. Okay.
Yeah.
So let's have a seat. Let me take a look. So sometimes it's just getting that joint to pump out some of the inflammation there,
Okay.
and then just getting you to walk a little bit more. So let me see how that's looking. Okay. Yeah. So we definitely still have a little bit of pressure on there, but it's definitely reduced. So that's a good sign. So in regards to what we're gonna do, yeah, it's definitely much better. So we're gonna hold off on adjusting that again, okay? Sometimes it's just best to let it heal, and then as that continues to heal, that inflammation will keep getting pushed out, and then that pain will start to diminish, okay? Now, we might need to shift a little bit to a different joint, but I think the best thing to do is, if we can, just icing this thing just a little bit, just to help to reduce some of the inflammation. And then when you come back in next time, we'll take a look and see if we're gonna work on the same joint, or if we need to move to something different, okay? Oh yeah, that moved really well. Yeah, that's clear.
Yeah, it feels a lot better in there.
Good. Let's take a look here. Yeah, that's looking much better too. Okay, so let's see how you do with that, okay?
Okay.
But like I said, if you can, walking is one of the best exercises you can do, both when you're in pain and too when you're having, pregnancy going on. One thing I want you to do as well is sometimes it's really good just to kind of get some side to side movement, okay?
Okay.
Now walking is a good thing, but getting those hips to move a little bit, that's actually really helpful because those joints have to kind of expand eventually, but making sure that those joints are lubricated by movement. Okay, so think of like motion as lotion for the joint. Okay, so we're trying to get movement in there just to kind of get those things kind of lubricated in there, so then that way it glides a little bit easier. Okay, so you can kind of relax your belly forward, bring it back, bring the belly forward, bring it back. And one thing that you can do is doing it on all fours, kind of like what's called a cat-camel kind of move, where you're kind of letting your belly drop down and then bring your belly back up, okay? And even when you're on all fours, you can kind of bring your pelvis back and forth just to kind of get movement in there.
Yeah.
Okay, so you can do it while you're sitting, do it while you're on your on all fours. The key is just getting the movement in there. Okay. So ice, get some movement walking, doing the movement I just showed you. And just keeping your hydration, keeping your water levels, okay? So let's see how you do with that, and we'll go from there. Okay.
Thank you.